Okay, good evening. So today I will assess you this letter. One thing that I want to mention you right now, you should have to use capital letters in your introduction, in your this thing. Not all the letters should be capital. What the first letter of a word? Okay, this should be capital. This should be capital. This should be capital. This, and that, there. Okay, so these all letters should be in capital. Okay, as I mentioned in previous video, you have to write full name of month in your introduction. 24 August 2012. Yeah, so I can see in your case notes they have given you the name of the doctor. If they haven't given you, if they give you the name of the doctor, then you should have to mention the name of the doctor as well here. Dear doctor, the name of the doctor is, wait a second, Liz Kinder. The name of the doctor is Liz Kinder. So you have to mention the name of the doctor here, dear Dr. Liz or dear Dr. Liz Kinder. Okay, so Mrs. referring Mrs. Jane, this date of birth 13/1973. That's good. I'm writing to refer Mrs. Jane, 8 weeks pregnant. She had two complicated pregnancy in past with preeclampsia. Currently she presented with symptoms suggested of urinary tract infection. Okay, this is good one. What I would like to say you something more better than this, like you can write your introduction in a better way. Okay, so how you can write it, something you need to improve is that you can write like I'm writing to refer Mrs. Jane, then comma, an 8-week pregnant woman with a medical history of two complicated pregnancies involving preeclampsia. Involving preeclampsia, then comma, presented with symptoms suggestive of urinary yeah, wait a second. So I'm writing to refer Mrs. Jane, an 8-week pregnant woman with a medical history of two complicated pregnancies involving preeclampsia, presented with symptoms suggestive of urinary tract infection or UTI. Okay, so you can also write UTI. So why you can write UTI? Because these some abbreviations that we can write short in short form, like UTI, BP, and then temperature. Okay, and something there are some of abbreviation that we can write in short forms like UTI, VP, and temperature, and something else as okay. And because we can write these in a short form because these are universal accepted abbreviation. Okay, so that's why we can write like this. So the second thing that I want to mention is that like preeclampsia, because here I want to mention one thing, like if we selected OET as an exam instead of other exams like IELTS, PTE, TOEFL, these things. So only one thing that you have to remember, only one thing that you need to pass your OET writing exam is you should have medical knowledge. Okay, so you should have medical knowledge. So I can see in your letters like you have a very well, you have a very well medical knowledge. I can see in your letters. Okay, so why this is important to have a medical knowledge in OET writing module? Because if we don't know what happened to the patient, if we don't know what is preeclampsia, we know that in preeclampsia mostly women have some symptoms like high BP and some other symptoms like we can say that, wait a second. Yeah, so now where we were, yes, we were talking about preeclampsia. So the main thing is that you have to know the what happened to the patient, and if preeclampsia, like if we take example of this preeclampsia, like we know that in preeclampsia women mostly suffering from high BP. If they mentioned only eclampsia, so we can say that a woman suffered seizures plus high BP. So why this why this is relevant to know? Because if we don't know the what happened to the patient, if we don't know that what is the meaning of the disease, so we cannot choose, we will not choose appropriate information to include in our letter. Okay, so I'm sure you understand what I'm saying. So the next thing that I want to mention is Mrs. Jane came to my clinic. Okay, so instead of that you can write like this, since 3 days. Okay, so you can write date here, so you can minus 3 days from this date, like 21 8 12 12 2012. So you can write like on 21 to 8 to 12, Mr. Jane came to my clinic with complaints of difficulty in urination. That's it. So I don't know why you left these blank spaces. This is not appropriate, to be honest. If you will do this thing in your exam, you will definitely gonna lose marks. Okay, so please don't do that. She is 8 weeks pregnant. This is not appropriate to use here. Okay, I would not. Yeah, she has a history of 2 miscarriages. You already mentioned these things in the introduction. Okay, you already mentioned she is 8 weeks pregnant in the introduction, so please don't repeating the informations. Her first pregnancy was complicated with raised BP which lead to emergency cesarean at 32 weeks. So that's a good one. Second pregnancy, this is not appropriate way to start this letter. Okay, so please improve, please factor and positive family history of thrombosis. Please write thrombosis in a good way. Okay, so the your examiner can understand what you have written in your exam. So both pregnancy needed low molecular weight heparin due to her being heterogeneous to factor. And yeah, on 2-day examination her BP on is 120/80 with urine dipstick shower, protein plus 3, nitrates plus 2, blood plus yeah. Yeah, you have mentioned all the relevant information, what not in a good way. Okay, with fundus non-palpable, suprapubically. Please, these two are different words. Suprapubically. Okay, with left, with fundus non-palpable. The spelling of palpable is not right, so please improve it. In view of her past history and age, she needs trazepine folic acid screening for Down syndrome. Okay, yeah, Down syndrome is the appropriate thing to include in this situation. You again start your sentence with lowercase letter. because here you mention the full stop and you start with the lowercase letter. If you again, if you will do that, you will definitely going to lose your marks. Down syndrome, her antenatal test and midstream urine is taken. Instead of that, her antenatal test and midstream urine is taken. Instead of that, you can write like her antenatal test and midstream urine has been taken. Has been taken. Okay. Has been taken. Her reports will be sent to Sprit Mother Hospital. Currently, she is prescribed cephaloram 250 6 hourly. Yeah, that's good one. But please improve that. You have did lots of mistake in this letter. I would give in geo this letter I would give C grade, only 300 scores. Okay, so if you want to pass your writing exam, you need to get 350 scores. 350. You need to get B grade. What you need to improve a lot. I know you can improve that, but please try to improve more as you can. Okay, so take care for now.